Hello everybody, this is Dr. Kumar Mohit. I'm a student of medicine here, Jonelta Foundation School of Medicine at University of Perpetual Health System, Delta. So today I'm gonna demonstrate you how to just examine our eye and ear. In the series of eye and ear examination, first of all we are going for the eye examination. So let's get started. This is Miss Dubey Sambhavi and she's gonna be my patient for today's demonstration. So do I have permission to just check your eyes and ear, Miss Sambhavi Dubey?
Yes.
Alright, she have given me permission for that. So for the eye examination, first of all we have to go through our eye anatomy. So we have to just observe the external structure first. This is the eyelid and then the cornea of the eye, lens and the deformities in the orbital or not. We have to observe that all structure physically first of all. Then we will go for the another test. We have to also observe the eye size, the pattern of the hairs on the eye, external structures like the conjunctiva and the sclera. Object two type of the conjunctiva can be there. Like first one is the palpebral conjunctiva and the second one can be the bulbar conjunctiva. So how we will differentiate the palpebral conjunctiva and the bulbar conjunctiva? The conjunctiva which is inside the eyelids, like here somewhere, this is known as the palpebral conjunctiva, and the conjunctiva which is here on the white part, we can see here the iris and the other structures, eye structures. Here we can get the bulbar conjunctiva. So normal people, the color of the conjunctiva is almost transparent or a little bit whitish something, but if a person have the conjunctivitis, then they might be have some infection and the eye color can be red or orange. So after the external observation of our eye, we have to go for the vision test. So in that we have to go for the visual acuity test. So for that we have one chart here which is known as the Snellen's eye chart. This visual acuity test is for the cranial nerve second test because we know cranial nerve second is optic nerve. So here the distance between chart and patient should be at least 20 feet. So the distance between patient and chart should be 20 feet. For this visual acuity test we have chart over there, and you have to just read the letters as much as you can read, okay, and you have to go up to down, okay, and I'm gonna cover her eye, one eye, and then okay, start now reading.
EFP.
So see how read that almost up to green line, and that's the vision acuity up to 20 by 20, and we write that acuity in two form, like upper 20 and the lower 20. The upper one is the distance from the patient's eye to the chart, and the lower one is the distance from the eye. A normal eye, a person can read that letter, okay. Here we can see in this chart we have different kind of the visual acuity, like 20 by 100. As the lower number will increase, the visual acuity will be low, very low, okay. So here it's perfect because it's 20 by 20, so it's good. Second test for the visual acuity is pinhole test. Approximately when we are seeing from this pinhole, that will increase our vision. At least we can just read one more line from this chart, okay. So let's see, this is pinhole test. So first of all you have to cover your one eye from this hand, and now just look at from this pinhole, okay, and read the letter
EFP T P Z D. That's it.
Yeah, that's fantastic because you have read it very fast. So it means somewhere and somehow the vision was increased. Because why that vision was increased? Because here is the very minute pinhole and the light is coming directly inside the center of our eye, okay. Now for next one we are gonna to just do static finger wiggle test, and that test is for the visual field. So we are going to find out the visual field here, and we have to make sure that our distance should be a little bit about 2 feet from the patient or one hand from the patient. And now what we are going to do, we have to just show our two fingers, and that should be laterally to the patient's ear, and the distance between ear and our fingers should be almost 2 feet. So here we are going to do that. So you have to tell me that when you will able to see the movement of my fingers, okay. So 1 2 3 go.
Yes, I can see.
Yeah, so here we find out that the visual field. If we find any difficulty in visual field test, then we have to just mention the boundaries properly, that up to what boundary the patient is able to see. We are going to check the opacity of the cornea. So yeah, it's fine, we don't have any opacity here, and here for the another eye as well we don't have any opacity. Okay, so that was for the checking of cornea. Now we are going to demonstrate you that how to check the pupil of eye. We have to know about the meiosis and the mydriasis, means the contraction of the pupil and the dilation of the pupil. So we are going to check it. We will just put our pen light here inside the pupil and we will see the movement of the pupil, means the accommodation power of the pupil. Okay, so let's see. Come closer and look at this. Please see laterally. Yeah, look at this. Just when we just put the light in the pupil and that was constricted. Look at this. Now we are going to do the test for the movements of the extraocular muscles. As we know, our eye is having the 6 kind of the extraocular muscles, like the superior rectus, inferior rectus, and the lateral rectus, medial rectus, and superior oblique and the inferior oblique. So these muscles are controlled by the cranial nerve number 3, number 4 and the number 6. Alright, so we have to just go for it. You have to focus on this point, okay, on the upper side of this pen, okay, and I'm going to make H in front of her and see, we have to see the movement of her eye. So let's start from here. This is the medial point. दिखा. Now we are going to do the convergence test. So we have to just tell our patient that they have to look at a point and then we have to just move that point closer to his or her nose, and then we have to just notice the movement of the eyes, that are in coordinated manner or not. So let's get started. So you have to just look at this, okay, on the pen point. So fine, that movement was fine. For the coordination of eye, we have to do one more test. That was the cover uncover test. So we have to cover our patient's eye and we have to just uncover it suddenly, and we have to see that where is the position of the second eye. It should be also seeing at the same point. Okay, so let's demonstrate this. So you have to just focus on my nose tip. Okay, okay, that was perfect. For the second one, focus on my nose tip. Okay, that was perfect. Means the both eyes are very coordinated. Now the last test is ophthalmoscopic examination. So we have to just observe the internal structure of our eye, like retina and optic disc, edges of the optic disc, and we have to also observe the physiologic cup and different type of the vessels there, like the blood vessels. We have to also observe the red reflex point, red or orange point from our retina of the eye. So this is our ophthalmoscope, and now we have to adjust it at the 0 diopter, and it's on the 0 diopter. Our index finger should be at the diopter adjustment here. We can adjust it, our vision, from here. And now we have to focus here, and we have to focus this light inside the eye of our patient. So before doing this, we have to just make our room darker. We have to turn off our room's light. Okay, so let's do it first. We have to put our left hand on the left side of the eye and adjust it properly. It should be a little bit laterally. Okay, so I'm able to see that red and orange reflection from that eye. Okay, so especially in this ophthalmoscopic test or examination, we have to observe the color of the retina inside the eye. So that should be red or orange, and what I have been observed, that was red or orange. Ophthalmoscopic examination was our last examination for the eye. We have been just covered the all fields like the external and then the vision of our eye with the different tests, then the different type of the extraocular muscle movements we have been covered, and then we have seen the internal structure of our eye also, like the optic disc and the retina and the sharpness of the optic disc edges. So we have been observed that all things, and the eyes were proper. So that was a good point, and that was enough for the eye testing. This way we test our eyes. So now we are going to examine ear. So we will just follow the same pattern. First of all, we will go through the external structure of our ear. At last, we will look at inside the ear with the help of the otoscope. Alright, let's start the demonstration of ear examination. So first of all, we have to just observe the external structure of our ear. Like we have to just palpate here. Is there any pus or any deformities here? No, so it's fine. We have to palpate it properly, so it's fine from the external side. We are doing ear examination, and our first test would be whisper test. So we have to just whisper in one ear of our patient. We have to cover the another ear with our finger, index finger. Okay, so let's go. We have to go at the back of the patient, then we have to just put our index finger in one ear, and I'm gonna whisper in this ear. We have to make sure that we should whisper in this ear from distance at least 1 feet. So let's start the whisper test.
ACB 2AB.
We have to repeat this test for the second ear. So we have done with this whisper test, and our patient was able to recognize our words and with the proper coordination. So next test we are going to do with this the help of the tuning fork. This tuning fork is 512 hertz tuning fork. Okay, so this is the best tuning fork for the test of the Weber test and the Rinne test for the AR conduction hearing. Okay, so we are going to do this with our patient, and let's see. So what we are going to do, I'll just bang this tuning fork here, and I'll just put it here in the mid of your head, okay, at the medial side, or we can put it here also on the middle of the forehead. So choice is yours. So, and you have to tell me that you are able to hear it properly from the both ears, or louder from one ear, or the lower from the second ear. Okay, how about that?
Yes, I can hear from both ears.
So both ears were fine?
Yeah.
Equally for that?
Yeah.
Okay, so that was the Weber test. As we have done with the Weber test, and we know that Weber test is for the air conduction of our ear. Now we are gonna for the second test, and that would be the Rinne test. And that test we do basically for the comparison between the bone conduction and the ear conduction. All right.
It disappeared.
Disappeared. Disappeared. All right, so that was the Rinne test. Actually, basically when we are going to compare with the bony conduction and the air conduction is more powerful than the bony conduction. Okay, so air conduction is for long time, but bony conduction is for the little bit lower than the air conduction. All right, so that was the Rinne test. So now we are gonna for the internal structure of our ear, means the structure which are inside of our external ear. Okay, so for that we should do the otoscopic examination. So I have here otoscope with me. We have to put it this inside of ear of our patient, and we have to observe it from this place. Okay, so let's get started. So first of all, we have to just pull the ear upward, backward, and the outward. Put the otoscope. We have to see the deformities inside of the eardrum, in the ear canal, and we have to look for the color of the eardrum. Okay, We have to observe with the otoscopic examination. We have to just see the eardrum and the ear canal. Might be there some exudation from the internal ear to the outer ear. Might be there some perforation in the eardrum, and might be the color changes. Most of the time we have the transparent color of the eardrum, but if that is too much reddish, that might be any bacterial infection, or might be the internal ear exudate inside our external ear. Okay, so that all for the ear examination, and with that we have been done with our 2 videos, like eye examination and the ear examination. Thank you so much for watching this, and have a good day.